We specialize in cosmetic to TMJ, pain type therapy to broken, worn, cracked teeth. A little bit more higher comprehensive style of dentistry than your average doc in a box style of dentistry, where somebody might just come in because they have something broke, need it fixed, and then leave and maybe not show up to the dentist again.
TMJ actually is a piece of anatomy. It's like your toe. It is a joint. It's the temporal mandibular joint. We all have two of them, but sometimes patients get a little confused and say they have TMJ, but really it's a joint that we all have, and it is really kind of the hinge on how we open and close our mouths. It's a very intricate joint, and therefore can cause a lot of problems when it's out of balance or out of harmony. And when that happens and the issues arise, could be pain, could be tightness, could be ringing in the ear. We call that TMD, which is temporomandibular disorders. And so those are kind of the two differences. The disorders then are what we specialize in trying to diagnose and treat and help patients get out of pain and function better. Some of the causes of TMD are too much force and too much stress on the system. So the system kind of makes up of three components. It's the joints, the teeth, and the muscles. And if any one of those is out of balance, I always like to use the analogy of a mobile above a baby's crib, right? If one of those is out of balance, the whole thing tilts or turns and twists. And so if one of those is out of balance, that's when we see problems and issues, and then basically call it TMD. And so it's our job to figure out which piece is out of balance. Sometimes it's more than one, and once we figure that out, that's what we treat too. Some of the things we use to diagnose is a real thorough head and neck exam, right? Pinpoint what's happening, what are the symptoms, how intense is the pain, how often is the pain, when does it come up. We really focus in on what's happening at the joint from a CT scan, really looking at the structure and the anatomy of the bone and the structures that are in there. We also look at airway. Sometimes airway, sleep apnea can contribute to some of the TMD issues. From the CT scan, we use an oral radiologist to also help us out with diagnosing and see what's going on. Also, we'll look at the teeth, right? So are there broken teeth, worn down teeth? What's happening with the bite with some of these patients? What's happening with the gum and bone that's happening? Sometimes gum recession can be a function of out of balance, TMJ harmony, or TMD situation. What I'd really like them to know is that it doesn't have to be as complex and scary and, surgical interventions that sometimes is what we kind of assume. Once it's properly diagnosed, there are some pretty simple solutions for patients out there.